going to call the meeting to order. It is 6:02. We'll do the Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. The other thing is without a administrative secretary, am I okay to just take the notes here and then, or does somebody else need to take the notes for the meeting? Okay. I was just gonna basically write it or do the notes on one of the agenda sheets that we have, make sure that all the votes are like when we take the votes, they're recorded, and then kind of double check with basically or another board member afterwards, say, hey, this is what I got. Does this, and then for the minutes, we can write them up again. Okay, cool. So for roll call. Alrighty. Roll call, board member Alanis. Board member Herrera.
Present.
Here. Board member Avalos.
Here.
Board member Rodriguez, I am here. Treasurer Gallardo, and she's absent. Okay, quorum is established. So we're moving on to public comments. This is an opportunity for members of the public. This includes those on Zoom to address the board on any matter related to the commission that is not listed on the agenda. Comments will be limited to no more than 3 minutes. Is there anybody on the Zoom? No. Alrighty. No members of the public? Alrighty. Moving on to potential conflicts of interest. Any board member who has a potential conflict of interest may now identify the item and recuse themselves from discussing and voting on the matter. Ready? We'll move on to the minutes. Take a look at those.
I did notice a typo on there. Did you catch that?
There's a
Okay.
couple.
Okay, I wasn't at the meeting, so I can't really,
Where's the typos?
There's a few name typos, and then
Okay.
I saw it on the computer last, and it pointed it out to me, so I can't find them right now. But I believe my last name was spelled wrong a couple times, but I'm not too worried.
So it's just the names,
I think
right?
it was just names, yeah.
Because everything else seemed pretty,
Everything else, anything of substance, I believe, was
this
Fine.
one here. Blog area needs P9s. Page.
oh yeah.
oh, yeah.
Okay. 10. Okay. If there's no major corrections, I'll entertain a motion to accept with the typo.
I second.
Righty. If with no objections, the minutes will be accepted. Okay. Verbal vote like that, or do I wouldn't need to call the roll, do I? Okay. All in favor?
Aye.
Are there any opposed? Alrighty. Motion passes. Okay. On to financial report. So with Letitia not here, we'll be it is okay, or it doesn't necessarily need to be heard at the meeting, but if she sends us a financial report, we can go over at the next meeting, correct? Or like she'll just she said she'll send an update at a later date. She just wasn't able to get it all together.
Can't she send you the,
You're good.
Can't she send you the information before the meeting so you can report it out at the meeting?
Yeah, she said she said she wasn't able to get that. She said if anything, she was gonna send a, uh, what is it, or a balance or anything, but she wasn't able to get the list that she usually types out together. And she was, that just happened, or she just let me know like, like a day or two ago that she wasn't able to get those two together. She said she was between houses and with all that stuff everywhere. She said that, I told her, yeah, okay, thanks for letting me know. I'll, you know, if it or if you send that report or whatever at a later date, I believe we can disseminate it to the board members and then they can at least have it. It doesn't necessarily have to be at a public meeting, but we will bring that report to the next public meeting, correct? And the next one, yeah, okay. That was my understanding, is that she could still do the report for this meeting as long, and then send it to the board members as soon as she has it, basically. And then review that one and this, and the next meetings at that next meeting.
Yeah.
Okay. As it was this one, yeah. Okay, cool. If there are any specific questions about anything, I guess email to her directly, and she can answer any of those deals. Moving on, discussion update from the governing documents ad hoc. So basically, what we kind of went over is the original thought of what the ad hoc was. So we had a whole bunch of conversations in between at meetings here. But what we came up with is the reason the ad hoc was created was so that we can, because there was several documents that contained a quote unquote mission statement from the board, but they weren't all in alignment. So there was slight differences between those. So our plan moving forward is to create a specific mission statement for the board and then do what's necessary to place those in the places necessary. So such as our bylaws, governing documents, and then there's also a specific, I forget the title of it, but it's like there's a mission statement and another governing document that we have on the website. It's slipping my mind right now, but there's two places that we need to add it in. But we want to make sure that it's the same one and not something similar, because similarity is never, it's not defined. So what we want to do is define our mission statement, bring it back to the board for approval, or what do you call it?
Discussion?
And then, once the board hears all that mission statement, we come up with that, then we'll put it on all of our governing documents. And I believe it needs to have 3 public hearings or something beforehand, before our governing documents change. So we'll go over what we want first and then we'll do those.
Typically, when adopting policy, you'll have 2 readings before adopting a new policy, but certainly for something like your bylaws, you want to take the time to make sure that you don't want, those are kinds of documents that you don't want to be changing regularly.
Mhm.
And so when you're making changes, you have enough time to make sure that the board is satisfied with the changes. Also, I would recommend certainly for any bylaw changes that you consult with my office or
Absolutely, yeah.
legal counsel.
Mhm. Yeah, so that we basically were defining the direction we want the ad hoc to go, because there was just a few tangents that we kind of were talking about, and we're like, you know what, Anthony made a good point. Let's get together the specifics of what we need to do, and we'll go that way. So that's what we're doing for now. The next one is item number 8.2, the here presentation from the Ride Foundation. That's not specifically from them, but we got some information from.
Yes, so I went ahead and got you guys a handout. And so what it is the Right Foundation. The core programs are veterans, first responders, that's a Queen Assisted Leadership Program. So what they do is they help first responders, veterans, they help youth, substance abuse, and what they do is what it does right now is people go up to the horse ranch, and right now they're working with the students for Fresno Unified. So the students go up there and they work with the animals and they work with other veterans and stuff like that. So it's very therapeutic, and it helps them with behaviors, and it helps them with therapy. And so what I did is I went up there, since I don't know if you guys have heard of it, but it's Nancy Hines, and it's the suicide loss team. So what happens is when you're first responders with the sheriff's department, there's a I don't know how to explain it, but when I barely started with as a chaplain for the sheriff's department, my area of service was call outs. Call outs, and what we do is when we get called out for a suicide, Nancy Hines sends out a mental health clinician along with the chaplain. We go hand in hand. We both meet there. So I'm part of that service for Nancy Hines. So I go to a meeting. We go to a meeting every quarterly. So when I went to the last meeting, they were working with the Right Foundation, and it's very therapeutic for people who are in distress. So I went up there. It was a great organization. They're a 501c. They're a nonprofit. So right now they work with Fresno Unified, and Fresno Unified takes kids up there, and the kids interact with the animals, or she takes the animals down to Fresno Unified, a certain school. So I spoke to the superintendent for Selma Unified, and I said, hey, I think this is a great idea. Let's see if we can cater to the continuation school, the students less served. And he thought it was a great idea. And I said, take it to the board, let me know. So I not noticed, but our health department only serves the city of Selma citizens. So if we can get the students from Selma Unified, and then we can work, I'm going to take this also to the Lions Club. So if we can use it as a service for the Lions Club and with the healthcare board, together we can maybe sponsor some kids to go to the Right Foundation. So, I know the Selma Lions Club, we take our kids up there. Everybody picks a day, we volunteer, and we take the kids up there. And there's a lot of kids that are not exposed to the outdoors, and they need it. They, for whatever circumstances they have, they do not get to be exposed to that, especially horses. I mean, how many times do you think kids, that are underserved are gonna go see horses, ride horses, have therapy, and I thought this was a great way, especially when you have veterans and first responders there that can also, that are also getting therapy, and their therapy is working with the horses, because those horses are Mustangs that were already gonna be euthanized. So she takes those horses that are going to be euthanized. She works with them. The veterans and the first responders work with the horses, and the kids work with the horses also. They pet them. They're in an arena. The kids go in there. She even pulls out the chairs for kids that are in wheelchairs. So they even have the opportunity to go up there. I mean, it's not very, it's not very often that you have a program that helps with
Or a special ed group came, because they went to that
Mhm.
ranch. Took the kids there.
Yeah.
It was very, very
Yeah,
good.
it's very therapeutic, very therapeutic. So before she said she would come out and answer any questions, but I said, first, let's talk, let me introduce it to the board. Kind of, let's see what we can do, because we only cater to the Selma community, because that's their tax dollars. We want to make sure that we're catering to our community, and then we can come up with something. And then I said, I'll also take it to the Lions Club. Lions Club doesn't care where anybody's from. So maybe we can partner with the Lions Club and see what we can do for the Selma Unified kids, or veterans, or first responders, or anything like that. And this to me was one of my passion projects. And she said, if wanted, she will come out and make a presentation. But I wanted to bring it to you guys first.
So it sounds like instead of just like a one-time kids go to spend times with the horses, this is more like a program, right?
Yes.
Where they have participants and it's kind of ongoing. So I would think, and it would be kind of similar to what Lorraine's doing with the meals for the seniors. is you would put together a proposal, so it'd be a board member-led initiative, put together a proposal, how this would work, how it would look, and then you can propose it to the board
Right.
as a separate, um,
Well, the only reason also I didn't, yes, that's what I was gonna do, but I wanted to put the feelers out. Also, I wanted to see what the Superintendent Gomes is gonna do, because then we could work together and bring a proposal together, her, Gomes, and us.
Mhm.
And just put a little package together and say, hey, yes, we can do this, no, we can't do this. I didn't want her to come over here and give you a presentation and not have my ducks in a row. I just didn't want to do that. So if it's something that you guys think we can go forward, I can go ahead and make the proposal. I can put it all together and then bring it to the next meeting.
But yeah, there's a couple of ways you could do it. You could work on making it like a district-led initiative. Or alternatively, they could apply using the mini grant proposal. Kind of just comes down
Right.
to the scope of the project
Yeah.
and who it's going to be serving.
Right, right. And I didn't know if this would be like when, on the Lions Club, when you bring a passion project, you say, okay, I want to pay $5,000 to the Right Foundation. That's a passion project that's funded every year. So it's just on the books every year. Every year in August, you're gonna give $5,000 to the Right Foundation. Every year, but I don't know how they do it. I don't know how the healthcare board does it. Is it a one-time thing? Is it something that, every year you guys do the swim? Every year you guys put money into the swim. Are you guys willing to put money into the Right Foundation, to help these kids, help these veterans, help these first responders? Is that something you guys want to do or just like a one-time?
I've got so there's different methods in which we can fund, the board can fund stuff like that. I feel like the best way would be for us to allocate and say, or it's a board-led initiative that we allocate, you know, when you come, they have the presentation and a proposal that for a board-led initiative to say, let's allocate, say, $5,000 for, you know, you basically distinguish the continuation students or Selma School, Unified School District, or the Selma Citizen Veterans, or whatever body it is, as long as it's in the city of Selma, of course, like you were saying, that for them to come and or for them to come and basically say like, hey, we'd like to take advantage of your Right Foundation fund, which then we'll pay for their expenses to basically to go to the therapy range, because I'm pretty sure that it wouldn't necessarily limit them to, or limit us to just funding like from a mini grant only. It allows us to do like, you know, veterans and you know, people in the community, rather than just a specific body coming and asking
Right.
us. Like if the school came and asked us for, with our current governing documents, we would only be able to give them a $5,000 grant specifically for Right Foundation stuff, or the Right Foundation, for the students, or for Selma High School students. And if it doesn't ever get used, it just stays there, you know, which technically if we allocate it and it doesn't get used, it you know, it stays with us as well. However, it opens the door for citizens, or, you know, veterans or citizens or whatever. It's a wider scope of wider range that we can help. So it's kind of like how her other board-led initiative was going. And we're basically trying to figure out when one of us board members comes up with an idea. We don't necessarily have a policy for that right now, but we are completely, we are under, what is it called? We are able to do stuff like that. You know, if a board member such as yourself comes up and says, hey, I'd really like to make a program that we do to fund people going from our city to go to this program, we should totally be able to do that. So
Yeah, Like I said, I didn't want, I wanted to know how moving forward, where we're at and stuff like that. Before I said anything to her, she was really excited. Oops, sorry. She does have a lot of kids that go there. And she does have a lot of, veterans who have PTSD and first responders. And it's so therapeutic. And I think once the community finds out that this is a Selma Healthcare led initiative and that we're open to, presenting the veterans and the students, the community therapeutic help through this venue, I think we'll have an overwhelming response.
And just for example, the USYN, they came and they asked for, when they came and asked for their grant included monies to go to the Heart of the Horse Therapy Ranch, which is a similar organization. So it's,
Mhm.
they just went a different method.
Yeah.
They went through a different method to, you
Right.
know, basically pay for the people who were
Yeah.
from here in Selma,
Yeah.
fund their deals. So it's, we've done it before. We can continue, we can
Okay,
do it.
Yeah, I would think that we would vote on it each year. Because like I said, the population may change. Maybe it's the kids. You said this year, and then next year, maybe it's the
Yeah.
veterans, and next year it would be, and then that would give opportunity for new board members to have input.
yeah. Well, thank you. Thank you for listening and, yeah,
I think yeah.
thank you.
Ready. We'll move on to discussion item number 3. Board will consider the feasibility, costs, and community benefits of pursuing a mobile Medicare medical unit to host or facilitate free health clinics and outreach efforts within the district. So this is something that I wanted to bring up, this and number 4, but specifically this one for now, or item number 3. I've seen other healthcare districts such
Mhm.
as I believe it was in Reedley, came across their mobile unit. And I was like, that's something we can totally do. We have an accumulation of funds right now that we don't usually. I think it's completely possible for us to pursue purchasing a mobile unit, you know, through the same methods or means that they did. It's really just, one, I wanted to feel out if the board wanted to pursue that, and then 2, how feasible is it, you know, for us to do that?
Wow, if I may. Um, I, I too thought about that, but I didn't want to purchase a unit because that's a lot of responsibility. But I did read, I did read Clinica Sierra is you've heard of it, no? Clinica Sierra. Clinica Sierra.
Yeah.
Yeah, Clinica Sierra. You get them and they go out to the migrants in the fields, they go out to the community, they do diabetic testing, they do all these healthcare testings, and they're a mobile unit. And then you tell them, hey, I want you to do this, I want you to do that, and then they go and do it. And then we're just saying, hey, we're gonna help you, and then you guys go out and do this. But I would be afraid to buy something. And then, yeah, staff in it, and then you have to buy all the supplies and you have to make sure that you have a license for all those supplies. Um, that's just my thought, but you're the nurse, you know.
No, I'm with you on that. I would think that we would partner with an existing mobile unit.
Yeah.
Because I've heard of that one. I believe Fresno State has a mobile
Yeah,
unit.
they have a mobile unit.
Adventist here in Selma has a unit, which part of our initiatives for mental health when we worked with them was on their mobile unit, they were going to have the therapist. When they did go into the lower income communities, the therapist for mental health was going to be there on site with that mobile unit. That was part of the agreement we had. I think they had some trouble getting that off the ground, but if it is up and running, probably a partnership with them who they staff it, they already have the route and the experience. That might be a better way to go.
Yeah.
And that's a great idea because, you know, since I got on the board, one of my passion projects was, you know, how the kids, before they go to school, they need their vision test, they need their dental, they need their shots. So I was gonna try to reach out to some of the, like the eye doctors, the dentists, and then pick a day, let us pick a day, a health fair. Remember they had a health fair at the hospital and it was in the, yeah. And just partner with people, like say, okay, can you volunteer your services? Can you do this? And have a health fair and then, right before school, like in July or August, and just have a huge health fair and see if people want to volunteer and then have the mobile unit go there.
Yeah, it's,
That's just my,
yeah. So well, my intention with this was one, to see basically how much we wanted to be involved in something like that. And I know as a
I
business
would be.
owner, I'm not about to go buy an entire computer setup to do like video graphic design. I'm gonna get somebody who does that and contract them out, which is exactly what you guys suggested. So like, that makes a lot of sense.
I'm interested in that. I don't want to buy it, but I want to work. I want to work. Yeah, I
Yeah.
want us to.
I mean, if Selma Healthcare District decide or happens to like grow a substantial amount and that seems like something feasible in the future, I mean, maybe, but I mean, or if it becomes like a really big deal that we're bringing these mobile units out, maybe look at it in the future. That's what I'm hearing. But for right now, definitely partnering with,
Yeah.
existing places. Um, yeah, starting out those kinds of services, getting to the people we serve.
Right,
So.
right.
Okay, that health fair sounds cool. Being able to bring out a whole lot of different, bring out a whole lot of different services to the community, I guess. I'm almost certain that we have like a similar one, but I believe it's aimed at seniors right now. But I mean, opening up and working with, the city to make it bigger.
Yeah, it sounds like it'd just be a matter of a lot of coordination. There'd be
Yeah.
some costs involved, but mostly it sounds like coordination and trying to get different vendors, entities, individuals to donate their time and services and specialty.
Because Joaquin Arambula is huge on that. And then we already have the contact from our behavioral health lady. What's her name? The one that came in. Our contact for,
The
what?
dentist?
For dentists.
Yeah, dentist. So maybe we can talk to her. Maybe we can send an email to Joaquin Arambula. Right.
Yeah. Okay. In the same, was there any other discussion on this one specifically?
No, I love it though.
Yeah. I like the direction that's going. The other discussion I wanted to have was, I'll read it first. The board will discuss the potential need, location options and benefits of securing an office space to support district operations and community accessibility. So this one, I guess it's just another, thing that I wanted to bring up. We have, at the moment, we don't have a current administrative secretary. But there is a whole lot of stuff that person needs to carry, or like, I have all that stuff right now, like all of our, what is it called? Meeting notes and everything. And like, there's just binders everywhere. And I have it at my office, which it's locked up, but I know that's not feasible and not the best best situation. Basically, do we, or does anybody have any input on how we can go about, basically what we need to make sure that the administrative secretary has their ability to work, and then also, to as much extent as we need, and also be within reason to, do the things we need to do as a board. Whether that be, getting a small office location, or I don't even know where their storage options would be, to be honest. So that's what I was gonna ask help for.
What size of storage are you looking?
So my first idea was, shared office space. However, there's not a whole lot of options here in Selma. There's like, I know in Fresno, there's a lot of like shared office spaces where you can rent like a cubicle, locked cubicle, and, have your access there, but we're just not a big enough town to have it here. And I don't think any administrative secretary that works for us is gonna wanna go all the way to Fresno to do anything, and they're not gonna use it as frequently enough to, have a complete office. So like,
How about we talk to other district secretaries and see what they do?
yeah,
Or, yeah, or once I know we're gonna have a closed session to discuss a, secretary, correct?
Yes.
Admin secretary. So what I'm thinking is after we decide on a person, then get their input, maybe they have a place in their house that is an extra room that they would want to just work out of instead of, well, let's say they live out of area, they would rather work from where they are at home versus drive to someone. We'd be paying for a place
Mileage.
here when it wouldn't be used. I
Oh,
mean,
I see.
maybe
Yeah,
just
that's
wait until we
We're,
pick
yeah,
somebody.
we would eliminate the circumstance where we get the office first and that person doesn't live here and doesn't even want to work
Yeah.
there. Yeah, okay,
That's good,
I
good.
see. That makes sense.
Okay.
Okay, I just wanted to bring it up to, discuss those kinds of things.
What about? The,
Yeah, I guess at least for discussion. So the issue that I've been seeing is that, um, the city, workers here, they go through and they just open up all the mail at once, right? And since ours it's a Selma Healthcare District, most of their stuff, City of Selma or like Selma, blah, blah, blah. They open everything, and because we're such a similar name, they open ours sometimes. And I don't think it's happened yet, but I mean, if something is sensitive information that they couldn't open, like I think it's kind of best that we have like a place that our mail goes to that only board members can grab, because if it's getting open like that, I feel like I'd feel personally that it's an issue. Sure, I mean, should the board, pursue getting a PO box, and then if we do, what procedures do we have to, follow to, because I mean, there's gonna be keys or access, stuff like that. I wanted to bring.
Yeah, I think all of these options are on the table, meaning, one, getting a PO box shouldn't be too difficult. I would imagine that there's somewhere here in town that, probably like a private, mail, packaging store that would offer something like that. With regards to, and then there's potential working space, and I think it's a good point. Maybe a working space isn't necessary. Could be. And then the other, as I'm hearing, is potentially a need for storage of records, which could be not necessarily a workspace, but just a storage space. Could be as small as a closet or as big as a storage. And I think all of those are good things to think about. I know some other agencies similar to this one, kind of, you can capture that all in one. If you find the right office space to lease, you can have the mail delivered there, the person could work from there, and it could be a storage spot. But to the extent you need to break it up, you could do that too, and it could end up being cheaper doing it that way.
Okay. So would would the board be okay with looking at all of our PO box options here? And then also all of the, I guess once we do get a administrative secretary hired, figure that out, and then storage as well. Those would kind of come next. I'll make sure to get at least the cost of the PO box here in Selma, because it'd have to be here, correct?
Yeah.
Yeah.
Well, and I think that'd be good work for the administrative secretary to do,
Oh, yeah. that
to
makes
help get
sense.
those things in place.
That makes a lot of sense. Okay. Cool. Alrighty. Any other discussion on that? No? Okay. Move on to action items. Number one, we had discussed, or we had, or we're gonna, how do I word it? I guess, table it, correct?
Yeah, I'd recommend just taking no action on this item tonight.
Okay,
Yeah.
yeah, so or I guess if the board is of consensus, then we'll be taking no action on item number one and refer it to our legal counsel and then we'll table it, and I guess if we do have reportable action, we'll say it next meeting or anything.
Yeah, we're gonna table this item for now, subject to legal review. And to the extent there is action, that would come at the future meeting.
There is reportable action, we'll have it at the next meeting. So number two, consideration of
Oh,
grant.
wait, back on that item. Just to clarify, are you going to get back with the enhancement committee to let them know why we didn't discuss it, then work with them to possibly resubmit?
Yeah, I didn't want to word it myself that way, so I was gonna ask, I was gonna basically, shoot an email to Craig and say, hey, how do I word this to them? Get in contact with them, get in contact with the person, what's Liz, she was the one who sent it in for the Selma Enhancement Committee. So that we can basically work out what, you know, figure out what it is, and then if it needs to be changed or different, then we'll,
Okay, I just wanted to make sure that,
it's not gonna be.
you
like
were
a charter or
responsible and
anything.
it didn't fall through the cracks.
No,
you
yeah,
know?
that, I need legal guidance on how to go about that, basically.
The verbiage.
The verbiage and how to, yeah. Okay. So then, if the board is okay, well, that's the action, or that's the path we'll take for that. Item number 2, consideration of grant request from Selma Babe Ruth for a pitching machine. And there's nobody from Babe Ruth, correct? No. Is there anybody on the Zoom?
Were they contacted that we were having the meeting, to discuss it?
Yeah.
They were.
Oh. Okay. All right. So the item has. Oh, they're out of order.
Hey, Craig, would we postpone this one since they are not in attendance? As
They're not
I,
here.
It's up to you. You could take action on the request as presented, just on the papers, but if board desires to speak to the applicant and hear more about the proposal, then you could table this to a later date. You don't have to take action, but I think you can based off of the application submitted.
I would think in fairness to them, because as what I see right here, I would be a no vote.
Uh-huh.
So I would like to have them present to explain a little bit more.
Yeah. That was also my, or I would have wanted that as well. I have questions about, or I personally, and from what I hear, the board also has questions about it. So if or I guess I don't necessarily need to entertain a motion, correct? We could just, table,
You don't need to, you could just take no action.
Take no action and-
have it brought back at a later date.
okay, so then we're gonna basically follow up with both of them,
Yeah,
get more information about
I think that's fine.
the deals and come back. Okay. So right now we have time for board reports. If anybody wants to kind of, this is essentially what where the ideas for discussion come about. I believe last time I was kind of mentioning like the things that I've been seeing with other places. So that's why I brought the items of discussion up. So if there's any, things we've attended, events, or anything we're invited to, any announcements or anything, this is the time to go ahead and do so if anybody has.
Um, well, this is my second year. I'll go first.
No, go ahead.
Second year, we hosted a sheriff's appreciation breakfast at Area 3, which is on Golden State Boulevard. And I partnered with the Lions Club, who funded everything, and we went out at 5:30 in the morning and made all the deputies breakfast. And I was so excited because our Sheriff Zanoni attended. And it was we were all shocked. I was embarrassed because I was wearing a t-shirt and shorts and not my uniform. So I was mortified, but it was awesome. The community came together, made breakfast, and they were just so appreciative. So I'm hoping to do that next year. And then I received a text. I guess the community is having a breakfast this Thursday the prayer for the first responders and first responders, right? So they text me if I would please pray out the community. So I was really happy with that. And I think we're really going in a positive direction with the health board, with taxpayer money doing what it's supposed to do, is provide healthcare services for our community, mental health and healthcare for our community. And I'm happy about that.
Well, we really didn't put any action behind where we talked about the mobile unit or like a clinic or a little health day, health clinic day. So I would like to possibly put myself on that one. I can reach out to my contacts there at Adventist, because we did discuss the mobile unit as being part of that healthcare initiative that we, mental health. So I can reach out to them, see if there's anything planned already, and possibly we can partner with them. And I can report back on the next meeting.
That'd be great.
That'd be awesome.
Crestwood opening, awesome place. They're starting out with about 6, 7 patients. We started out with about 6 to 7 patients. There's a rec room, library, physical therapy. They have, it's nice. It's all enclosed, secured, locked. It's really nice.
Could you tell us what it is for the,
Behavioral health facility.
Behavioral health. And basically what it is, if I'm correct, it's court ordered
Mhm.
patients that they're there, and it's like rehab to get them back out into the community. And afterwards, they actually help them get jobs and stuff.
So I spoke to the medical director there. And what it is they cater to the, I don't know how to say this. They cater to the inmates that are not competent to stand trial. So there's 2,000 on the waiting list that have not been able to go to trial for their crimes because they've been deemed incompetent. So they're working with, that's all they cater to is those individuals. So it's very interesting.
so as far as a little bit that I know about it, and so that facility is located in the strip mall
On McCall.
on McCall, okay. And do they have the inmates there now yet?
They have about 6 to 7 that they've started with.
It's very fast. I mean, you look at it and you just think it's a little hole in the wall. And I'm
Yeah.
like, really? And then when I walked in, it went, whew, and it's just beautiful. You have to go take a tour.
Yeah, sunlight,
Yeah.
a sunlight room, and they have individual rooms with connecting bathrooms.
It's just amazing.
It is, it's very nice and very secure.
So it's a living facility where inmates are like rehabbing to, or close to like coming
Yeah,
out and stuff?
yeah.
Okay. Wow,
I
that's,
don't know if they're coming out, but
To be competent.
yes,
be
they're
competent,
trying to make
yeah.
them to see if they can be competent to stand trial. So he said they have 2,000 on the waiting list that
Wow.
need to go to trial, but have been deemed incompetent.
wow.
Yeah, it's,
That's a very, that's
I-
a specific
wanna
underserved
go
population
volunteer
I
over
would
there.
never have even thought.
it's very amazing. I mean, and the staff they've already hired, except they need a couple of case managers. Case managers and dietary aides. And everybody was very professional. It was very warm and welcoming. And
But
It-
they have this in Kingsburg also.
Name of the outfit?
Crestwood.
Crestwood Behavioral Health. Now, there's one in Madera by Valley Children's called Rio Vista, River something. And I did a tour on that one, and it's just amazing. But it caters to kids. You even have like a 1-year. They cater to like a 1-year-old. And I'm like, I would never bring my baby here. You know what I mean? But it's needed. These facilities are needed. Really should go take a tour on that one. I'm sorry, I didn't mean to interrupt you.
It's okay.
I did get one, oh, that's gonna
Oh,
be.
well, yeah,
clo-
well, we
that's
can go
closed
to
session.
closed session.
Never mind. I'm sorry.
For myself, I basically took charge of the whole, uh, receiving information for the meetings and stuff, and I did my best. However, I'm like uber busy, and so while we figure out a administrative secretary, I'll do my best to make sure that we have at least everything that we got. I will probably be subpar when it comes to this whole secretary deal, because I am not in the same position that I was beforehand when I did this. And even then I was stretched thin. So, I will do my best to make sure we got what we need. So if anybody didn't, or if I ever, or if in this time, if I ever am missing something or any of these deals, just please let me know or shoot me a text or an email and say, hey, I didn't get this, or is this coming out, or whatever it is. Let me know.
Are we gonna discuss future meetings?
Yes, so we have the closed session deal, which shouldn't be a super long deal, but do we want to discuss the meeting dates first before we do that? Yeah, okay,
Take it out of order.
alrighty. Is that the wishes of the board? We do the meeting dates first?
Yeah.
Okay, let's do the,
Please,
let's look at what our schedules are like for those meetings and then sure we get all that done.
Do you know the city's
So
calendar here?
I don't have her.
First Tuesdays.
Yeah. Yeah, so they do
First and third.
Tuesdays. So I was gonna or I would suggest, I guess, since I know you said Mondays are work better for you, or you
Tuesdays,
Tuesday, or Monday's okay is my question, I guess.
that vary.
They vary? Okay.
Well, Tuesdays, every other Friday, every other Monday.
Okay, so then the Mondays are gonna be spaced a little bit. All right. So in terms of these facilities themselves, the Monday day looks better for us because the Tuesdays happen. And then the city tends to have a lot of special meetings on the Tuesday as well. So it's like really far and few between that there's gonna be Tuesdays available. And then if they do or have a special meeting, we wouldn't be able to use it. Like they would use the facility and we'd have to go somewhere else, which is also a possibility. So if we could choose, I guess, the Monday days that you're available, because then it would, and then I would have, there's 3 steps right here. We'd have to choose the Monday dates that we're all available. I'd have to also check with Letitia after today, and then also the facilities here, which ones are for the days that they're available. So
Yeah,
if we could choose like
Yeah, my days, that far out, I don't have on my calendar yet. I couldn't-
so at least
couldn't
for
give it to you.
today, if we can do a general or one for our immediate next meeting,
what month are we doing the next?
it can be late February, early April, or that's actually, yeah, February, early to mid February.
I can do February 9th, 23rd, because I can't do Groundhog Day. I'm kidding.
I understand that.
And the 16th is President's
President's Day.
Day.
Yeah.
So I can do the 9th and we're talking about Monday, right?
Yes.
I am open the 9th and the 23rd.
Just- I'll just put it down on my schedule and I'll try to get the day off if I'm not off already.
Okay.
Yeah, I'm looking
was
right
it?
now. I think I'm currently available those days.
Okay.
Yeah.
I think the 9th is probably,
Ninth.
yeah. Yes.
February.
I feel like maybe the best way to go about the next dates are gonna be figure out the dates that the facilities are available here with the city staff, and then I'll we'll do doodle polls for the rest of them.
Yes, perfect. Thank you.
And then I guess we'll figure it out from there. That'd probably be the best method of action.
Good.
For future. Okay. Righty, okay, so we'll just, I guess we'll move into
Yeah,
closed
just
session.
ask if there's any public comments regarding the closed session.
Are there any public comments regarding the closed session? Or anybody online or in the room? Nope. Alrighty.
Yeah, now the board will convene in closed session.
Okay, the board will convene in closed session and come back when we're done.
Do you typically